So welcome. In today's session, we are going to look at the histology of the spleen. This is not my first video, the spleen histology. I've done another video using a virtual microscope, but today I'll be using some notes for further understanding, but you can also look at the other video. So by the end of this session, we should discuss the spleen stroma, the parenchyma. We'll also look at what is the marginal zone of the spleen. And to finish, we look at the spleen circulation. Welcome all. My name is Wallace Munyere, and I'm the Yule Daktari. So spleen, let me hide this. So spleen, it is the largest lymphoid organ that filters blood and helps in the removal of all the red blood cells and maintains immunity. It is located in the upper part of the abdomen, that is in your left hypochondrium. It has lateral diaphragmatic surface and medial visceral surface. I hope you have done this in your gross anatomy. And the visceral surface has a hilum. Now, through the hilum, splenic vessels enter or leave the spleen. Splenic artery will enter, splenic vein will leave. Now, what will I see when I take a spleen and cut it? What will I see grossly? Now, we will see white pulp and red pulp. White pulp is the grayish white areas that are scattered through the substance, throughout the substance of the spleen. And surrounding the grayish white areas is the red pulp. Now, what if now I take that and observe it under a microscope? The white pulp will show aggregations of lymphocytes, and it is basophilic when you use the hematoxin and eosin stain. Then the red pulp will show presence of sinusoids, which are filled with the red blood cells. And between the sinusoids, you will see some cords. Okay. Now, let's look at that. Here, I have summarized the histology of the spleen. In fact, if you understand this table here, this flowchart here, my friend, you are good to go. Now, spleen, let me take this. Now, spleen, capsule and the tuberculatory, these are the stroma. Then you have the parenchyma now and the marginal zone. Now, the spleen is covered by a dense connective tissue capsule, which contains myofibroblasts. Myofibroblasts are contractile cells, which will help in the expulsion of red blood cells, because you'll see that the one function of the spleen, especially in animals such as the horse, is storage of blood. Then trabeculae usually arise from the capsule and enter into the parenchyma. Okay. Then we also have reticular fibers. Now, parenchyma, it has white pulp and the red pulp. White pulp are the darkly stained basophilic areas. Then you will have central arterioles, which are surrounded by the periarterial lymphatic sheath. Now, the periarterial lymphatic sheath is made up of the T lymphocytes. And also, in some areas, you'll find the splenic nodules. But where you'll find the splenic nodules, the arteriole will no longer be a central arteriole, but an eccentric arteriole. And it is made up of B lymphocytes. And they have, remember, the splenic nodules of the Malpighian corpuscles, they will have the germinal center. That is where the B lymphocytes are actively dividing. And the arteriole will be eccentric, as I had said. Then the red pulp. The red pulp consists of cords of Biloth and the splenic sinusoids. Cords of Biloth are made up of red blood cells, lymphocytes, macrophages, plasma cells. The splenic sinusoids are lined by elongated endothelial cells known as the stave cells. Those cells look like staves. Okay. And they are filled with the red blood cells. Now, marginal zone. it is the area which surrounds just within the vicinity of the white pulp. Between the white pulp and the red pulp, it contains numerous antigen-presenting cells, such as the macrophages. Okay, with that, you are done with the histology of the spleen. Functions: it is a site for multiplication and activation of lymphocytes. Phagocytosis of old and damaged red blood cells. It is the graveyard of red blood cells. And it is also the hematopoietic. It has a hematopoietic function in fetal life. Okay, spleen, it is where blood is formed during fetal life. But once you become an adult, that is when our red blood cells go to be destroyed. So now let's look at each and every one individually. Capsule and tuberculary, that is the stroma. Now the spleen is covered by a dense connective tissue capsule. Then tuberculari arise, or receptor arise from the capsule and enter into the parenchyma of the spleen. And the tuberculari usually divide repeatedly. Then reticular cells and the reticular fibers form a meshwork in the spleen. Okay. Now, connective tissue of the spleen also contains the myofibroblasts. These are contracted cells that contract the capsule and the tuberculari and help to discharge blood, stored blood from the spleen. Here you can see the capsule here, and it is sending in the tuberculari. Okay, and also you can see as the tuberculari is sent in, you can see here we have the trabecular arterioles. So arteries and the veins will, are found within the trabecular. Okay. Now let's look at the white pulp first. Now we are done with the spleen stroma. Now let's look at the parenchyma. The parenchyma is composed of the white pulp and red pulp. White pulp consists of lymphoid tissue. Now trabecular, please understand this. Trabecular branches of splenic artery give rise to the central arterioles that enter into the parenchyma of the spleen. Okay. Now white pulp forms sheaths. We have sheath, a sheath of lymphoid tissue surrounding the central arteriole. Now, that sheath is known as the periarterial lymphatic sheath. Okay? Now, the periarterial lymphatic sheath are cylindrical masses that run along the long axis of the central arterioles. Now, in cross sections, the periarterial lymphatic sheath looks like a mass of lymphoid tissue surrounding a central artery. Okay? Now, periarterial lymphatic sheath contains T lymphocytes. And please go and look at your T lymphocytes. We have, I think, 4 types of T lymphocytes. The memory T cells. You also have the helper T cells, the suppressor T cells, and the cytotoxic T cells. Go and look at them. Or you look in your physiology or in your immunology. Okay. Now, the T cells, remember, they originate from the thymus. So the periarterial lymphatic sheath is the thymus dependent zone of the spleen. So in an MCQ can be asked, which is the thymus dependent zone of the spleen? So remember, it is the periarterial lymphatic sheath. Now, we have also the splenic nodules or the Malpighian corpuscles. Now, at some places, B lymphocytes proliferate within the periarterial lymphatic sheath on exposure to antigen, and they will, and once they proliferate, they will form a germinal center. Now, such nodules are called the splenic nodules or the Malpighian corpuscles. Now, once they form, they will push the central arteriole. They will push. See, they are proliferating, so they will push the central arteriole to lie on one side. That is why it is called the eccentric arteriole. It no longer becomes a central arteriole. Now it becomes an eccentric arteriole. Okay, due to the formation of the germinal centers. Now let's look at an image. Here you can see an artery there. Artery there is surrounded by the lymphocytes. Here you have expanded. Now, here you can see white pulp. Here you can see that this artery is not at the center. It is somehow pushed to one side, so it is eccentric. So this one is a splenic nodule. Okay. Okay, here you can see. So these are your B lymphocytes, the germinal center. But where you will see a central artery, like here, no matter how small it is, you can see the artery here, there is right at the central. So this is the periarterial lymphatic shield. And it forms the thymus dependent zone in the spleen. Now, let's look at the red pulp. The red pulp forms major part of the splenic parenchyma. It consists of two components, the cords of Biroth and the sinusoids. Now, the cords of Biroth, which were first seen by Christian Biroth, an Austrian surgeon. Now, the cords of Biroth, or the splenic cords, are irregular anastomosis cords made up of reticular cells, fibers, lymphocytes, macrophages, plasma cells, and a large number of red blood cells. Okay. Now, splenic sinusoids. The cords of Biroth are usually separated by the splenic sinusoids, and which have a wide lumen. Now, the splenic sinusoids are lined by elongated, please understand this, elongated endothelial cells that lie parallel to the longitudinal axis of the sinusoid. Now, those cells, they are banana shaped. They look like staves, so they are known as the stave cells. Now, the basal lamina of the sinusoid is usually discontinuous to allow free movement of the red blood cells in and out. Then, adjacent endothelial cells are separated by a larger intercellular space that allows the red blood cells to pass through the blood cells. That is, remember, the lymphocytes can easily, they want the blood cells to enter and leave the cords of Biroth. Now, the wall of the splenic sinusoids does not have pericytes or smooth muscle cells. Now, as red blood cells are present within sinusoids, as well as in the splenic cords, it is usually difficult to distinguish the splenic sinusoids. Now, one feature, if you take a stave cell and look it under an electronic microscope, you will see that it has the cytoskeleton within it. You see fibrils within it. Now, those fibrils are important in the opening and the closing of the sinusoids, the spaces between the stave cells. Maybe we look at that. Okay. This is the pulp, the red pulp, which will contain, it is hard for you to distinguish where the cord is and where the sinusoid is, but it will contain some red blood cells. You also have macrophages within it. Okay. Here you can see clearly this is a splenic nodule. Okay. But this, can see this. Now this is the periarterial lymphatic shield. Okay. But in the others, you can see you have geminocenters. The arterial is eccentric, but here it is central. So this is the periarterial lymphatic shield, but this is the Marfegian corpuscle, or the splenic what? Marfegian corpuscle. Now, the marginal zone. Now, the zone of red pulp that lies immediately surrounding the white pulp is known as the marginal zone. It will contain a reticular network of blood sinusoids, lymphocytes, numerous antigen-presenting cells, and macrophages. Now, what is the function? Antigen-presenting cells usually bring circulating antigens into contact with lymphocytes in spleen and induce required immune response. Okay. So these antigen presenting cells, they will go where the antigen is, they digest that antigen, then they will bring some specific peptides to this, to the lymphocytes, so as to induce the required immune response. Some of the antigen presenting cells, remember, like in the skin, we have your Langerhans cells. So have other cells such as the dendritic cells, macrophages. Okay, now splenic circulation. Now, please understand this. The splenic artery usually enter the spleen through the hilum. Okay, then splenic artery divides into trabecular arteries that run in the splenic trabecula. Now, trabecular arteries will give rise to numerous central arterioles. Now, and the central arterioles will run through the periarterial lymphatic sheath. Now, central arteriole finally enters the red pulp and divides into numerous peninsular arterioles that follow a straight course. So the peninsular arterioles pursue a straight course. Then the peninsular arterioles will continue as the sheathed capillaries or the ellipsoids. Now, these ellipsoids are surrounded by macrophages. Now, there are two concepts in splenic circulation. We have two types of splenic circulation, open circulation and closed circulation. Okay. Now, open circulation is where the sheathed capillaries or the ellipsoids open into the red pulp. Okay, they usually open into the splenic cords of Biroth and the blood will pass through the splenic cords of Biroth and finally enter into the splenic sinusoids. Okay, in closed circulation, the ellipsoids will open directly into the splenic sinusoids. So they will not open in the splenic cords of Biroth. Okay, so splenic sinusoids drains blood into trabecular veins. Then trabecular veins will form the splenic vein. Now, splenic sinusoids are lined by elongated or the banana-shaped endothelial cells known as the stave cells. Now, if you take the stave cells, as I had said, and look it under the electron microscope, you will see cytoplasmic fibrilles, which help in the opening and the closing of the intercellular gaps, hence play a major role in the trapping of aged or damaged red blood cells. So when the damaged red blood cells want to close through that intercellular space, it will close and it will be trapped. Then the macrophages will come and phagocytose it. So here you can see the trabecular artery. You can see that here, this central arteriole, which will finally form the ellipsoids after forming the peninsular arterioles. In closed circulation, it opens directly into the splenic sinusoids. You can see they are lined by the stave cells. You can see how elongated they are. And others, in the open circulation, it will open directly into the splenic cords of Biroth. Then blood from the splenic cords of Biroth will eventually reach the sinusoids. Sinusoids drain into trabecular vein, which will form the splenic vein. Okay, the same here. You can see here at the marginal zone. Here, you can see at the marginal zone. There we will have numerous antigen-presenting cells. Okay, so as to induce the required immune response. In closed circulation, you can see that they are draining directly into the splenic sinusoids, and you can see in open they are first draining into the splenic cords of Biroth. Then blood from the splenic cords will eventually enter the splenic sinusoids. So, what are the functions of the spleen? Performs an immune function. It has immune function as well as hematopoietic function in fetal life. That is, spleen activates lymphocytes by using antigen-presenting cells, okay, and induces an immune response. Spleen is the site for proliferation of both T and B lymphocytes. It usually also helps in the destruction of old and damaged red blood cells and platelets. In embryonic life, spleen will act as a hematopoietic organ, blood formation. Also, spleen stores some small quantity of blood. Okay, so I think we have come to the end of this session, and thank you for your attention. And please subscribe for more anatomy and biochemistry content. Thank you.